Breaking news back here at home now in Texas, where health officials have confirmed the first death from measles during a worsening outbreak. 124 cases have now been identified, mostly in West Texas. Babies, children, and teens make up 101 of these infections. Nearly all were either unvaccinated or hadn't received their second shot. I'm going to bring in Dr. Vin Gupta, pulmonologist and MSNBC medical contributor. So, Dr. Gupta, first, just your reaction to now there's death.
Anna, I unfortunately, I'm not surprised, and this is a tragic set of circumstances because we know that measles is very preventable. The vaccine, 97% effective, the 2-dose regimen at preventing this from happening. So this is a tragedy across the board. In terms of what your viewership needs to know, 9 in 10 people that get exposed to somebody with measles, so say a child that's has measles, say in West Texas, if they're surrounded by other unprotected, unvaccinated children, 9 out of 10 of them, it is estimated, will actually get exposed and infected as well. That's that contagious. We also know, Anna, from historical data, about 1 in 4 unvaccinated children that are infected will end up in the hospital. That is a very, very serious number. And there's major complications, severe pneumonia, encephalitis, which is swelling of the brain. So this is extremely serious. And I worry that this might be the beginning of more.
We know that there had been a reduction in vaccinations. Well, now Lubbock's director of public health reporting after seeing, more unvaccinated children and families that didn't believe in vaccines. They are now seeing those families getting vaccinated because of the numbers that are growing in this outbreak. Is it common, do you think, for these types of outbreaks to trigger people's newfound belief in the vaccine?
Fear is actually very motivating. We saw this in the peak of the pandemic in places that saw hospital surges, not just in the United States, but elsewhere, that actually compelled people to go and get vaccinated. And so, yes, fear does motivate. Unfortunately, if it's very proximal, it's even more motivating. So, yes, we should see more of the uptake of the vaccine, which is great because even 1 dose is 93% effective, and that works relatively quickly. So vaccination, even acutely in the setting of an outbreak, can be helpful.
Well, I'm so glad you told us how contagious it is for those who are watching and were concerned about the vaccine, to know just how deadly it could be to not be vaccinated, especially with measles on the rise. Thank you very much, Dr. Vin Gupta.